Hey, I am Sarah Carnes and welcome. We are here on Facebook Live with Trillium Creek Dermatology today. Dr. Torek is here answering all your pediatric skincare questions. Now, thank you so much for having us out to do this because I'm a mom. There's so many times where I'm like, what is this on her skin? What is going on? Even with myself, it's good for parents to be prepared and just know some of these common skin conditions. So this is your opportunity to ask Dr. Torek here questions. All you need to do is comment your question down. We'll get those answered for you. I'll go ahead and start things off, but go ahead and let us know what your questions are. I'll kick it off, Dr. Torek. And I want to know kind of what are the most common skin conditions that we see in children? Because I feel like I've seen a lot as a mom.
Yes, we all see rashes, right? As moms,
right?
Yes, we see lots of rashes. So it depends on the age. So under the age of 1, we'll see more cradle cap, that greasy, crusty,
Yes.
You can just peel it off on their scalps. That's the most common we'll see, and diaper rashes.
Of course.
Right?
I saw plenty of that.
Red bottoms, the sores, yeah. And then after 1, we'll start seeing more eczema. The rashes that itch, they itch, the children can't sleep. The blisters on the face, the scalp, the arms, but primarily at that age more on the face. They can't sleep. The parents can't sleep.
Yes.
Everybody's irritable and miserable because everybody's itching.
Yes.
Then after about 3, 4, 5, we start to see more like infections, warts, maybe a little psoriasis on the face. In children, you'll see psoriasis more on the face than you will see on the body, because in adults, you'll see it elbows, knees, scalp. In children, it's more the face or even the bottom in the diaper.
So eczema is a big one. Can I ask about that? Because I feel like I have so many friends where their kids suffer with eczema. I know even my older daughter still suffers. What are some of the best treatments for that? Is it over-the-counter stuff?
So what we have found in eczema, which is becoming more and more prevalent, is trying to keep our children clean, healthy, away from things, induces more of their eczema. So get them dirty, get them into mud, get them into the zoo. We are now telling you children to expose them to peanuts early, so they don't get the allergy to the peanuts, don't get the eczema. All right. And then hydrate and lubricate the skin from the day they're born. The lubrication with things like CeraVe, Cetaphil, things like that over the counter. As you hydrate and repair their barrier, their skin, less chance of getting eczema.
Oh, that's very interesting. Very interesting. What are some of the common allergies that you see in children?
So lanolin is the most common one. Lanolin is found in a lot of your moisturizers, and that comes from sheep. So lanolin is also found in wool. So wool clothes will make them itchy and irritable. Lanolin will break them out and make their eczema worse. We are also finding children, now they're playing with slime at an early age. They get slime eczema from the slime that they're playing in. Their hands are a mess, and then they're touching their faces. Their faces are broken out. Their hands are broken out. So lanolin, fragrances, scented products. Everything has a scent these days. So anything scented is really highly allergenic to children with eczema.
So is it just like a process of elimination when you feel like, I don't know, maybe my child he doesn't like wool shirts, so maybe that's the problem.
Right.
So kind of how would you know if it's one of those allergies? Are there tests that can be done, or is it that process of elimination? Like, okay, well, let's not wear this shirt anymore then.
It's kind of both. When a child comes in and you're suspecting that they're allergic to lanolin or fragrance or wool or things like that, we do patch test them. We don't do it under 3 years of age. So we glue things on their back. There's no pinpricks like you do in allergy testing.
I've actually had this done.
You've had patch testing?
Yeah, it's not bad. It's not bad at all.
It just drives you crazy the first night because you can't sleep. You're all glued up trying to sleep. In children, we only leave it on 24 hours, and they'll light up. They get all blisters where they're allergic to something. In adults, we leave it on for 2 to 3 days. It just takes us longer to react. In a child, they react quickly. So patch testing is really the standard.
So I want to go back to the slime, because that is so huge. I mean, I can't even tell you the amount of times we've made slime at my house. It's like that everywhere. There's something called slime dermatitis, right? So is that what you were mentioning when they're having this reaction to it?
To the slime, to the chemicals, ingredients in the slime. Yes.
So is it just we don't play with slime if we feel we have a chemical reaction? Is there different?
You're actually allergic to it, so you should never touch
Yeah.
it again.
Okay.
Okay, because slime is allergenic, especially to children who have eczema already,
Yeah.
or people who have asthma, because asthma makes you more sensitive, your skin more sensitive.
Okay.
So a lot of asthma patients, as they get a little older, they will get eczema.
Oh, that's so
Okay.
good. And like I said, I know so many people that have their kids have eczema. It's such a common problem. So I think we have a question here from Megan. She says, is it better to see a pediatrician or a dermatologist if I have a question about my kid's skin? Very, very good question.
Dermatology has 3,000 diseases that we have to be tuned into and aware of. Most of the childhood diseases like measles, mumps, which we don't see much anymore anyway,
Yeah.
or some of the common rashes in children, pediatricians do a very good job.
Mhm.
Very good job. But if there are questions that you're not sure of with the pediatrician, then yes, come and see the specialist. Let's see the dermatologist and see what we can find. We work with also pediatric dermatologists. So they do pediatrics and then dermatology. They're specialists in pediatric dermatology. So if we can't figure it out, that's a problem.
Right.
Then we work with a pediatric dermatologist, especially some of the rare genetic diseases that they see. Yeah.
Yeah. Oh, that's good to know. Now, you mentioned something just a minute ago about asthma and eczema being related. Can you touch on that just one more time? Because I think that's a big deal.
That's a big deal. It's called the eczema march. So most children, when they get their eczema early on, they outgrow it by the time they're 9 or 10. When they get asthma early on, the asthma goes away, but sometimes that asthma marches into the skin, and that's called the eczema march. So you get eczema, you get asthma in the skin, which we call eczema.
Wow.
Asthma is an allergy of the lungs, eczema is an allergy of the skin.
Okay.
They're
I
related.
never thought to
They're
think of it like
related.
that.
Yeah.
Yeah, that is very interesting. I want to talk about something else now that some people may be familiar with, some not. What is Dupixent and how is it used in children?
Dupixent is
Dupixent,
a
I'm sorry.
wonderful, wonderful, it's a miracle. We call it a miracle. Children with bad asthma, 6 and up, if you give them a Dupixent injection, their asthma is gone. They can breathe, they can be outside, they can be around animals. It actually cures their asthma as long as they're on it. And they eventually outgrow it, they don't need the Dupixent.
Okay.
For eczema, it's a lifesaver because these children can't sleep. They're miserable. Their skin thickens, it bleeds, and they're digging at it. You can start them on Dupixent once a month. That's all they take. It's an injection, unfortunately, and children get squeamish. But it's a miracle. Their skin literally heals back to normal.
Wow.
It is. I'm telling you, it's a lifesaver. I have never seen anything so miraculous in dermatology as Dupixent for eczema children.
So if a mother's watching now and her child has eczema, that's something she could reach out to a dermatologist.
As long as they're 6 years and up.
6 years and up. Perfect.
Yes, and you know what? It's almost always covered by insurance.
Oh,
it's a very expensive medication.
Yeah.
But the insurance companies know the struggle parents have with asthma and eczema, and it's almost always approved.
Oh, that's good.
And the children feel so much better. They'll come in and lay down. Okay, I'm ready for my shot. I'm serious.
They don't even mind.
The first 2, you have to hold them down,
right.
and then after that, they go, okay, I'm so much better.
I'm ready.
Yeah.
Oh, yeah. Well, we have a question from Desiree as well. She says, what's the best age to start bringing children for a full body prevention check?
So it depends on the history in the family. If there's a very strong family history of melanomas, atypical moles, skin cancers that start at a young age, then I always tell moms, as soon as they start in their teens, bring them in for a body check.
Yeah.
My youngest patient with a melanoma was 10 years old.
Really?
A very aggressive melanoma. And my youngest that died was 20 years old. One of my patients. So it doesn't just happen to old people.
And that's what you think, sometimes in your head, you don't realize that it can impact children too. Wow, very good question. Jess would like to know, with summer coming up, what type of sunscreen do you recommend for children? Another great question.
There's been a lot of research, and the FDA is now investigating sunscreens. The sunscreens that have the chemicals in them, not the titanium dioxide and the zinc oxide and the iron oxide. Those are your mineral sunblocks. But the other ones with the cinnamates and all the other benzophenones, those are chemicals. What they have discovered is that they're finding it in the blood of children. So the
Wow.
FDA is saying, okay, now how is it affecting the children? What is it doing to the red cells? What is it doing to their lungs? What is it doing to their system? They're actually investigating it. And we'll probably see a ban on the chemical sunscreens. Hawaii has already banned it. Australia has banned it.
I have
The
heard that.
Keys have banned it because it's destroying the corals.
Mhm.
So what's it doing to our children? You know?
Very, very
Yeah.
good question.
So there's a lot of research going on.
Okay.
So in the meantime, use your iron oxide, zinc oxide, titanium oxides, your mineral oxides, which are very safe.
Good. Those are what I use.
Yeah.
So
Yeah.
I'm doing something
Yeah.
right.
And they stay on and they block.
They
Yeah.
do. They work
Yeah.
great.
Yeah.
Olivia would like to know, she says, my nephew is only a few months old and has acne. What remedies do you suggest?
So acne in newborns or under the age of 6 months, that's from hormones from the mom. Okay, so that's called infantile acne. All right, that's from the hormones from the mom. Just wash with a little normal Dove soap, and that dries up on its own. I wouldn't put any kind of medication on an infant for their acne. That dries up.
Well, and just piggybacking on that question, have you seen a rise in acne in children to begin with? Maybe like 7, 8, 9 years old versus, 10, 20 years ago. And that's a young age to start probably treatments. So what do you do for kids in that age bracket, maybe those preteen years?
That's a very, very, very good observation. Very good point, Sarah. So we have hormone stimulators. A lot of our foods stimulate hormones in young girls. So they're having menses at 7 and 8 and 9. You have plastic containers. Those stimulate hormones. Why do you think they ban those in children's bottles? All right. The bisphenol A stimulates hormones. Okay. So everything you eat in a plastic carton stimulates hormones. So do paper cartons, do your paper wraps. Try not to do plastic unless it says BPA free. Periods start early. Okay. Your food, all your hormones in your food, your meat, the cows. So organic would be preferred, hormone-free food, hormone-free milk, hormone-free meat. Kind of decreases the incidence of acne. There's a lot of medications that get passed through all the food that we eat. So watch what you buy, foods for your children, your bottles, things like that.
It really is so important.
It really
what
is.
we put in our body kind of manifests out on our skin in different ways.
And then there's an interesting point in England. What they found is, we're into essential oils everywhere in the world, right? So what they found in Europe is moms were applying lavender oil to little baby boys, and they started developing breasts. Yes, breast nubbins. So don't put lavender oil on your little boys because that is a hormone stimulator.
Wow.
Fascinating, huh?
Oh my goodness, that is fascinating.
Lots of essential oils.
Yeah. Vicky has a question. What is the difference between a freckle and a mole? That's a good one.
So a freckle is a flat little brown spot in sun-exposed surfaces. So it's just a little pigment that comes up into the skin. A mole is actually made of what we call nerve cells. And you have flat little moles, elevated moles, or really elevated moles. So those are growths. Those are not induced. Well, you see more of them in sun-induced areas. You do. The more sun you have, the more moles you have. The average number of moles is 40 to 50 on any given person. In an adult.
Wow.
Yeah. But if you have a lot of sun exposure, you're going to get a lot of moles.
Oh, interesting. Let's see. Chelsea says, what soaps do you recommend for sensitive skin for children?
So we used to say buy cleansers, Cetaphil, CeraVe, Eucerin. They have gentle cleansers. The average number of ingredients in a cleanser is 20. There's 20 chemicals in a cleanser. Whether it's your lipstick, your makeup, there's 20 chemicals, preservatives, all kinds of things. So now we're kind of going into the Dove for sensitive skin. Not a lot of chemicals in there. There's no preservatives.
Good.
A lot safer and a lot gentler.
Oh, that's great. Amanda would like to know, should you bathe your child more or less when they have eczema?
They used to say years ago, don't bathe them very often.
That's what I used to hear.
Yeah, not anymore.
Really?
Children love to splash in the water.
Yeah.
Put them in the bath water. Put a little bit of oil in it, sesame seed oil. You couldn't put a little olive oil in it, a little coconut oil. So when you take that baby out of the bath, it puts a sheen of oil on their skin, and then hydrate them. Use something like a CeraVe cream, Cetaphil cream, something with barrier repairs in it. Okay.
That is really good, really good. Carissa has a question. Is it normal for a mole to grow at the same rate as a child? Is it natural for a child's mole to get darker or lighter?
So moles, there are moles that lighten, and those are called halo moles. You'll see a little white halo around a mole. That means it's disappearing and it's lightening and going to go away. Moles lighten in adults. We gray, we lose our color, so our moles will lighten up. Will they darken? Yes. Moles can darken when you get pregnant, when you're on hormones or birth control pills, and they darken with age. Yes, they can. Yeah.
That is such great information. I want to talk about warts real quick too, because that's such a common thing that happens in children. First of all, are warts contagious?
Very, very, very,
and
very.
I guess I never knew that.
It's a virus.
Yeah,
right?
I didn't think about it, but yeah.
So you'll see children who especially bite their nails or suck on their thumb. So they've got a wart on their fingers, and guess what? Guess where they get it? All over their mouth, their nose. And that's a problem. You have to burn those off.
So should you try to treat it at home first or go right to the pediatrician?
I think a home treatment is a good idea. They have salicylic acid plasters. You can apply it to the wart.
Yeah.
They have the freeze away, the little canisters.
Yeah.
And that's effective as long as you use it the right way.
Okay.
Usually they have a long nozzle. Cut the nozzle so it's not so long, so it doesn't warm up as it comes out that nozzle, right? And the instructions on that can tell you, use it just once.
Okay.
No, it's the freeze, thaw it out, freeze it again. Okay. It's that thaw cycle in between that's really effective. So don't read your directions in this case. Freeze it twice.
Okay.
And you do it like every 2 weeks, and a lot of them will go away.
Oh, that's so great.
Yeah.
Laura has a question. She says, what are red moles?
Red moles, those are probably what we call cherry angiomas. Those are little red dots on the skin we all get. Some people get hundreds and thousands of them. Some get a few. Now, blonde, fair people do get pinkish moles. They have no pigment in them. But I'm probably certain she's talking about the cherry angiomas.
Yes.
Yeah.
Yes. Very good.
That starts in your 20s.
Yes.
Mm-hmm.
And I see those a lot. I even have friends like, what is this? What is this?
It's a cherry.
Seems pretty common.
Yeah.
Chelsea wants to go back to the warts for a second here. Mm-hmm. She says, how do we keep our kids from getting the warts? Because we just talked about how they're very contagious, especially with pool season coming up. Is it spread through water?
Not warts as much as molluscum contagiosum. Those are spread through pool water. I mean, if you have babies and you're putting them together with a child that has molluscum, all the kids that have been exposed in the water will probably get molluscum contagiosum. Those are white pearly bumps that just kind of spread all over.
Okay.
Those are easy to treat. Warts in a pool or in water, usually you don't get them spread like that. They're more contagious from touching, children playing with each other, or going to bathrooms where somebody has touched something. Okay. The virus will sit there a while.
Sure.
Right?
Sure.
All right. But it's spreading to each other.
Okay. Yeah. Good to know. Erica wants to know, this is a great question. I've heard so many moms talk about this. It's kind of going back to where we were talking to you earlier. She said, my son has stubborn blackheads on his nose. Any recommendation?
So what is a blackhead? A blackhead is oil that comes from the pore. Okay. Right? It's an oil.
Yeah.
When it hits the surface of the skin and the air hits it, it oxidizes. It turns dark. So it's an oil column. So people use charcoal masks. They use the little Biore strips.
Yeah.
You can't pull that out. You literally have to take a little instrument called the comedone extract. It's a blackhead remover. Just go along the nose and just peel them out gently.
Now, is that something we go to the dermatologist for?
Yeah, we do it. You can buy those online. They're called comedone blackhead removers. You can do that at home with your child.
What is it called again?
Blackhead remover, a comedone extractor.
Comedone extractor.
But what does your skin do? It'll produce another column of oil.
Listen, is there a way to not have that happen? We don't want blackheads.
You can inhibit the oil production. We use lasers, like an air laser to decrease the amount of oil you're producing. In young ladies, we can put them on birth control pills or something called spironolactone. There's a topical product coming that's going to really reduce the amount of oil you're making. That's going to be coming out sometime later this year. that's going to decrease the amount of blackheads you're going to have.
So if you are prone to oily skin, that's a contributing factor.
Very much so. Yeah. The more oil you have, the more blackheads, especially in the T-zone right here.
Yeah.
Yeah.
Oh, such great information. Such great information. Such great questions. Thank you for them all. I just want to thank you for your time today. This was so wonderful. If anyone has any other questions, you can call the office. You can talk to them right here. We'll put up the information. Just really thank you for your time today. For more information, you can go to their website. Like I said, give them a call. It's tcohio.com to learn more.
Yeah. Thank you very much.